Portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
Joining us live in studio is Dr. Mark Hiatt, Executive Medical Director of Regence Blue Cross Blue Shield of Utah. Doctor, we want to talk a little bit about home remedies. A lot of people rely on home remedies. So for what?
People use home remedies for a variety of reasons. Some to lose weight, others to prevent cancer. Some people just to treat symptoms for which there aren't really medical treatments available.
Yeah, my mind goes, danger, Will Robinson. This might not sound like a very good idea.
That's right, Brian. It's because these home remedies or natural therapies haven't been put through that rigorous clinical review process that we would expect from pharmaceutical medications.
Right.
And there really may be two problems. One, these remedies may not work. And secondly, they may actually make you sicker.
But should we ignore them entirely? I mean, it seems like there is some benefit, or many people have received some benefit from some of the things that they do.
Many people have. So we should not necessarily ignore home remedies, but we should certainly approach them with a healthy dose of skepticism.
All right, let's talk flu right now. I know it's kind of the beginning of the flu season. A lot of people are thinking about getting their flu shots. How's the flu season looking as we're beginning this whole thing?
Not too good.
Really?
Yes, health officials are concerned because in the southern hemisphere, especially in Australia, there's been this strain of the flu that's notorious for making people sick, particularly older people.
I saw an article the other day that said that there was a group of, and I don't mean to beat up on millennials, but that they are so tough in general that they just say, I can power through this, and they go to work anyway. But that is never the right advice.
That's not a good idea. And of course, millennials are those aged 18 to 34. And a lot of them just say, hey, I'm going to go to work even if I'm sick. But that's not a good idea because you can make your coworkers sick as well.
I was just going to say, I know everybody probably has one of those employees around the office. I have never missed a day of work in, 10, 20 years.
And, I respect that on some level,
I do too.
except for you're hurting your coworkers.
Yeah, what do people need to do, obviously?
So the idea is really be considerate. Don't expose others. Call in sick if you feel sick.
Yeah.
All right, let's talk about peanuts. And I have a dear friend who has a child with a peanut allergy. And so I am particularly sensitive to this in every area. So is there anything that can be done? I mean, what do you do? Do you expose your child to peanuts in early life? Give us some advice here.
Well, Amanda, the old guidelines said up until 3 years, avoid peanuts. Don't expose your children to peanuts. There are actually new recommendations out which completely spin that around and say that you really should expose your children to peanuts and peanut products before the age of 6 months.
Why the change there?
The change is really based on a lot of findings and upon the science that there's a window in which you can actually train your immune system not to overreact.
So we're talking about peanut butter for a child under 6 months?
Well, just a taste of that peanut paste between the ages of 4 and 6. There's one caution, though. If that child may be at high risk of having an allergy, then that experimentation should be done in an expert's office.
Okay.
So that a reaction can be monitored.
They're ready to go in case something really bad happens.
Who's at high risk?
Those children who may have an allergy to eggs and also a high risk of having eczema.
Interesting.
All right.
Okay.
Doctor, we learn so much every week, and we
great.
appreciate you. This portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.